Hi, Mark Jamin here, Medical Director for the Haywood County Health Department, and let's talk about this pandemic. Now, I'm sure you've seen that Georgia plans to fully reopen in the next week. South Carolina and Tennessee have indicated they will follow suit. And you've probably noted these three states encircle western North Carolina. So, what might that mean for us? To date, none of the positive cases in Haywood County have come from out of state. Elsewhere in western North Carolina, though, some of the cases have. We're a traveling society in a world, which is why the spread of coronavirus has been so wide and so fast. From a public health perspective, what those states choose to do will impact those around them. The virus isn't very interested in maps or borders, and I hope these other states are taking their neighbors into consideration. Whether the virus is here or comes from outside western North Carolina, the playbook is the same. Identify and isolate those infected, and effective contact tracing and quarantining for those with a concerning exposure. Although what those states do increases our risk for exposure, it does not have to increase our risk of infection. For us, the recipe remains unchanged. Avoid, or at least reduce, the viral load you are potentially exposed to by keeping your distance, avoiding crowds, and wearing a mask when you can't. Keeping the virus from getting inside you. Wash your hands before you touch your face. A mask might help here too. Quarantining if you've had a concerning exposure. Stay at home. And if you get sick, isolate yourself. You can go to previous video number 7 to get an in-depth look at what that requires. And if you get sick, going to the emergency department if you get trouble breathing. None of this changes. Your willingness to follow these measures has made all the difference. These measures will remain a critical piece whenever we reopen, and even after the county is reopened as we move step by step. Right now, county government, health department, emergency management, and the hospital are all working together, grappling with how and when to safely reopen. State and federal guidelines help, but the details are for us county by county to sort out. And so we're reaching out to our neighboring counties to best coordinate those plans. And I can safely tell you this, there is no playbook here. Everyone's feeling their way through, using the best data information we can get. But it would be misleading to say that there is any information or data out there that makes it totally clear what to do and when. You've worked hard to get us all in a good place. We don't want to ruin that. So be well, remain emotionally connected, and physically distant.